Okay.
Dr. Nelson usually leads the way and Kiltz sort of follows.
Okay.
Good morning, everyone. It's the 5th of January, 2025. Today would have been my good friend's birthday. If you've heard the story, the one I shaved my head for. uh, he passed away a few years ago. But good
Happy
morning,
birthday.
everyone. Please let us know where you're watching from. We are Florida heavy today because Dr. Phil is in Tampa, Dr. Kiltz is in Sarasota. I am in Central Florida. So let us know where you're watching from and hashtag KMT for a chance for a t-shirt, right?
That's right.
I don't know if you had something else, but
I just put it there.
Okay.
Just as you said that. I do have two announcements real quick.
Go ahead.
Tampa Meetup. We are 4 weeks away from the Tampa Meetup, so everyone needs to get their tickets and come and join us for a day of education, fun, and food.
Where do we get our tickets?
We get it at kiltzhealth.com, or you can get it inside the KMT, or you can get it in the link that I posted into the chat.
Awesome.
And in 10 days, we are releasing the on-demand version of the Kiltz Health Coaching course that you'll be able to get inside the Kiltz Mighty Tribe. Free to join the Kiltz Mighty Tribe.
All righty. So today we have Dr. Phil Smith. He's a medical doctor. He is retired from the practice of medicine, from life. And he has a story to tell. So we're gonna ask him some questions. If you have any questions, put them in the chat. So Dr. Phil, let us know who you are. Many people here know who you are, especially if they visit the Steak and Butter Gal gang. Tell us your story and tell us how you became carnivore, because it is not really a frequent thing to have medical doctors endorsing eating lots of red meat, right?
Mm-hmm. Well, thanks, Dr. Kiltz and Dr. Nelson and the gang for having me here today. And pleased to be with you all. It's been almost a year since I've been with you, I think. And I see some SBG people, Amy and Roxanne. Some of them are under different aliases, but I want to correct you, Dr. Nelson. I haven't retired from life.
No. But not from life. I said not from medical practice, but not from life.
I've retired from medical practice. I'm going to be 69 here in a couple months, and I retired back in 2019. Had been a family physician, but I had spent the last 20 years of my practice 25 years in the field of clinical informatics. And I went around and automated hospitals. I led the teams that went in and redesigned everybody's workflow and put in electronic medical records and got them off of paper and automated every job in the hospital. So I became a little bit of a process engineer because I had to know how everyone did their work and so that we could automate it. And that's what I did for a living. When I was in practice, I was actually left practice because I was very frustrated. I had really shifted my practice in the 90s to rename it to Health Lifestyles, was my corporate name. And I had basically preventive medicine, fitness, and nutrition as my focus in my practice because I really believed in conquering chronic health. But at that time, it was very hard because insurance companies didn't want you to do chronic health management. They didn't pay you for it. And I had a nutritionist on staff, and we worked with a lot of people, did a lot of dietary intervention, everything from Dr. Ornish, who was very high carb vegetarian intervention, to keto, to never heard of carnivore, of course. And I had a heart infection in 2001 called a viral myocarditis. And it was pretty devastating. It paralyzed the whole anterior wall or front wall of my heart. And I was literally short of breath walking across the room, having night sweats and all kinds of things, and was very, very sick. But fortunately, with a couple medications and time, I was able to heal that. But I gained a lot of weight and burned out my thyroid. So I developed hypothyroidism from that stress, and I gained 64 pounds. Prior to that, I had been a runner. I'd run 2 miles every day, 5 days a week, and had been in pretty good health, but my health just kind of declined over the 20 years. And eventually I developed metabolic syndrome. And in 2023, decided I need to do something, so went keto. But I was kind of getting up to date on keto, watching YouTube videos, and I was very discouraged because I felt like the keto community was more focused on dessert hacks than health. And I ran into this guy who you know real well, Kerry Mann on Homestead How. Don't know why it came up into my feed, but I watched this video from him and heard about carnivore for the first time in late July of 23, and started researching it, listening to all the physicians. Ran into first Dr. Berry, then Dr. Chafee, then Dr. Kiltz, Dr. Ovadia, eventually Dr. Baker, and everything they said made sense to me. So on August 3rd of 2023, I became carnivore and joined SBG after 90 days because I felt like I needed a community. And a month later, I had reversed my insulin resistance, and my blood pressure had normalized. My weight was down. My waist circumference was down 4 inches, and I felt pretty darn good. So I've stuck around to contribute. I don't see myself as a carnivore doctor like Dr. Kiltz. I see myself as a doctor who does carnivore. And I have a master's in physiology that I got during med school. I did a joint degree program, MD-MS, just for the fun of it, because I was bored. I'm a little hyperactive like Dr. Kiltz is, so overachiever. So I enrolled in full-time graduate studies as my second year of med school and did a master's in 12 months with research, human research. And the rest is history. So now I like to focus on helping people with insulin resistance, since it's something that I've reversed myself and have to manage for the rest of my life. So that's my intro.
Very good. And it's interesting that you became carnivore when you first heard about it from someone who is not a medical doctor. And it so happens the story is very similar with me. And I just went carnivore about 5 weeks before you. So doesn't have to be a doctor. It did make sense when I started looking into it. What do you think, Dr. Kiltz?
And I think that's why it's so important for people to share their stories, because you never know when you're going to influence someone that wouldn't have been influenced any other way. And I guess there's an old saying that when the student is ready, the teacher appears. And I think that's absolutely true, that and I encourage people to tell their stories and not to be too shy about it, because you just don't know who you're going to help.
Phil, this is really amazing. And, you know, so many of us, we suffered as doctors, like all other human beings, and the standard approach that we were all working in just wasn't working. And, you know, it's interesting that these communities that have been developed in order sort of to take us from our standard in the box thinking to a storytelling that isn't a prospective, randomized, double-blind, placebo-controlled study. And I'm curious a little bit about how your informatics and how you transitioned from standard practice into the informatics side of things. How then your transition into this carnivore space, how all those things kind of lead you to where you're at today.
Great question. The reason, back in the early 90s, I really was fascinated with computers and thought that a computerized medical record made sense to me. And as far as I know, I was the first doctor in Florida to go totally paperless in
Wow.
1992. And I would literally have patients would leave my office with printed prescriptions that were on a half page of paper, perforated, and 1/3 was a prescription typed up, printed by the computer, signed by me, and then the other 2/3 was list of potential side effects. And it was so funny because I had immediate recall of every patient, and I started getting referrals from all over the country because I would print out records and send them. We have a lot of snowbirds in Florida. And so I believed that anyone that was a snowbird, when they went back to their home doctor, I printed out their records, and I had what today we call a clinical summary, a list, a problem list, their visits all typed out and clear. And it was so funny, Robert, that I had patients that would come in as new patients from Michigan and places like that. And I said, well, how'd you end up coming to us? And he said, oh, my doctor in Michigan said, you're the best doctor in Florida. And it was because the doctor probably treated one of my other patients and liked the fact that I always sent the records from their winter down in Florida back to them. And I started having people come in who said, oh, the pharmacist told me you're the best doctor in town. And we never have any med errors with him because we can read his handwriting. And so I transitioned. I saw where things were going. I was very frustrated with Medicare when they started to say you have to charge this amount of money exactly, and you can't charge anyone lower amounts of money, which I thought was nuts because I used to see a lot of indigent patients at reduced fees. And then because the law changed, I had to start seeing them for free. And they had no skin in the game. I mean, an indigent patient paying $3 for a doctor visit has more skin in the game than someone that's getting it for free. And it's just human nature. If you're not paying for something, if you get it for free, you don't imagine the value. And that's always a problem when you offer free things to people, is they don't take
Absolutely.
They don't appreciate what you're doing for them. And I just got frustrated with medicine, and I saw how it transformed my practice. And so in 95, I had the chance to lead our local implementation of 10 hospitals that were going electronic, not fully, but doing clinical systems like labs and things like that. And I volunteered to head up that project locally and volunteered to do it, and learned how to do it at a hospital level. So I knew how to do it at an office level, hospital level. And then I went and worked for a EMR vendor for 2 years as a physician consultant. And then I went on my own and ended up being the chief medical information officer of Adventist Health System, which owned 36 hospitals at the time, automated them, and then went on and automated hospitals all over the country. Ended up automating over 70. My last was Moffitt Cancer Center, which was very, very hard because it's very complicated, but I got it done. in the early 2010s, and then went back to my consulting until I retired. So I saw the connection of how do you help the largest number of people get the most benefit, the best chance in life. And with carnivore, I'm a big believer that you have to be in a tribe. You have to be around other people, because the world will drag you down if you just hang around and listen to the average person who has poor metabolic health, and they never criticize you if you're eating a bag of chips or
Pizza.
pizza or anything, but they think they need to criticize you if you're eating healthy for your health. And it's the craziest thing. And I just believe we have to be out there and be strong-willed and be an example and help others to get their health, because your health is the most important thing you can do.
You mentioned problem lists.
Yeah.
In your medical records, and I'm wondering how would we change now we're in the carnivore world, how would we change that problem list? Before it was hypertension, metabolic syndrome, diabetes, cancers, pain. Do you think we could change that problem list around, maybe? Because we're not labeling the cause, are we? We're
Right.
sort of like what you're complaining about, and like you're just a complainer. It's kind of what. And I wrote down problem list, solution list. But what are your thoughts on sort of how we would reframe the problem list?
Well, I think that, for instance, let's take insulin resistance, which is kind of one of my favorite topics to talk about. Insulin resistance is at the center of so many things, and inflammation is at the center of so many things, and they feed into each other. And if you think about inflammation and insulin resistance as a devil's partnership, right? The devil's couple. Think about how many diseases are related to those two things. And it's hard to separate one from the other because one causes the other. So if you have one, you probably have the other. So, but we look at sleep apnea, we look at obesity, we look at hypertension, we look at diabetes, we look at hyperlipidemia, we look at cancer. I mean, all these things, arthritises. I mean, all these things are related. And as I teach in the insulin resistance course, what do doctors focus on? They focus on your blood sugar. And your blood sugar is hard on you if it's high, but long before your blood sugar is high, your insulin is high, and your insulin isn't working well. And you're really treating hyperinsulinemia because of insulin resistance. And so what do the doctors do? Well, they give you medications prescribed to help bring your blood sugar down, when that's just treating a symptom, what we call a sign. So symptoms are things you feel, signs are things we measure. So in medicine, we talk about signs and symptoms, and the whole health industry is geared towards treating the sign of hyperglycemia. But hyperglycemia is not the disease. Hyperglycemia is the consequence of the disease. And I think we focus too much on the diagnosis. And I've heard you say many times, autoimmune diseases. Autoimmune diseases, we get caught up in the labels of Sjogren's syndrome or Raynaud's phenomenon or rheumatoid arthritis, when we really need to talk about it being a complex triad, and you're somewhere on the spectrum based on how your particular body and your genetics express that inflammation in your body. So those are the two big things we need to focus on. And according to the CDC, the last stats were in 2021, there are 96.7 million Americans with undiagnosed insulin resistance. So current population that was based on was 342 million people. So About 28% of the population is walking around with hyperinsulinemia and insulin resistance, and they don't even know it. So,
and our solution list, is it long or is it short?
well, I think we have two things. I think we have not a solution list. I think we have an action plan.
Okay.
I think
I like it.
I think an action plan is where we should head. So, is your diet inflammatory? Yes or no? Okay. So, an anti-inflammatory diet, proper sleep hygiene, stress management, activity level. Are you moving? Are you in? Do you have meaningful relationships with other human beings? How's your spiritual walk? These are all very, very important things that come together to lead to optimal health. I'm sure I'm missing some, but those are the biggies.
I like that. Yeah, the action plan, because our problem list in standard medicine leads to a diagnostic modalities and then therapeutic modalities, which usually run in the medications or other procedures, but really our dietary habits and our standard system is flawed in sticking to the old 3 to 6 meals a day, high plants, low fat, lean meat.
Mm-hmm. Well, also, we create biases when we label problems because let's take diabetes. When I say someone, as a doctor, label them as type 2 diabetic, that is such a wide spectrum because you have people that can manage it on diet alone, on metformin, on some need insulin. Some have kidney damage, some have eye damage, some have liver damage, neurologic symptoms, dementia. And we use this term diabetes, type 2 diabetes, but it doesn't really tell us what we need to know about the patient because it's such a large garbage can to throw the patient into. And we need to be more specific. And that diagnosis is helping us to do some population thinking, but it doesn't help us at the individual level to know what the individual needs to reverse their disease and get healthy again. And we've moved too far from individualized medical care to population-based management. And doctors have checklists and things that they have to do to fulfill their reward system that they're on. They're incentivized to put people on statins if their LDL cholesterol is high, even when that is not what they need. And it's just the incentives in healthcare are just not aligned appropriately as I would do it if I was designing a new health system.
How are we doing on there with some questions?
We got some great questions here.
Got a bunch.
Yahweh fan, how do you get enough magnesium in your diet?
I love magnesium because it is something that's important to me because here I was with someone who had damage to my heart. And when I took, and I had metabolic syndrome, which caused some microvascular disease, which we call small vessel disease, to both my heart and my brain. And after taking my 2-dose Pfizer vaccine, because I'm a good Floridian and I have a now 96-year-old dad that I see regularly, I did take the COVID vaccine. I took the Pfizer 2-shot, and after the second dose, 2 weeks later, I started having atrial fibrillation,
Oh, wow.
paroxysmal atrial fibrillation, which means I only have it once in a while. And magnesium is a very important electrolyte for anyone that has congestive heart failure or atrial fibrillation. And so it's not very well absorbed, but certain people, a small subset of us, need more magnesium just to stabilize things. So for me, I live in Tampa. We have this neat place called Tampa Floats. And I go in once a month and I float in a tank of magnesium sulfate for an hour.
Wow.
And that equilibrates all the magnesium I need for the month through my skin. And believe it or not, if I do it more frequent than every 4 weeks, I actually get leg cramps from too much magnesium. So I have found that I can actually normalize my magnesium that way, and I've not had an atrial fib episode since August of 24. So I've gone a year and a half with no more atrial fib, which I'm very, very pleased with. So that's worked for me. I don't think the average person needs to take magnesium, but the nice thing about magnesium, we have so many ways to get it. If you're having sleep issues, magnesium glycinate is the best absorbed of the magnesiums. If you're on a diuretic, you should probably be taking, so that would be drugs like Lasix, furosemide, things. If you have congestive heart failure, if you have asthma, those are all things that improve with some magnesium supplementation. If you have constipation, magnesium citrate is the best form to take because it helps. It doesn't get absorbed very well, and it helps with chronic constipation. So I don't recommend everyone supplement with magnesium, but if you're in one of those classes of people that need it, I certainly encourage you to take it and take the one that's going to give you the most benefit because we have so many choices.
What about this? I got it at Sprouts. It's magnesium roll-on oil. What do you think of this stuff?
Well, as I said, magnesium does get absorbed through the skin.
Oh,
So
okay.
it's all about, cost benefit ratio. What do you do and what do you need? And I lay in a tank of 1,100 pounds of mag sulfate once a month, and that equilibrates me. So I think it would take a lot of roll-on to get that exposure.
You can do the same at home with an Epsom salt bath, but it's not probably the large amounts in a tank.
And the most efficient way to do it is you can actually get magnesium salts on Amazon, which are a lot of magnesium chloride, which is actually absorbed even better. So if you're using lower volume like you would do at home, you can buy those, and they come in a big blue bag about this big, and you use half a bag in the bath. And it is absorbed better than and it doesn't have that sulfuric smell to it.
How about bathing in the sea?
Yeah, bathing in the sea. That's another one for us Floridians. But
get in the ocean.
It's really hard for those in New York City and up north and everywhere else.
Next question. Can we discuss high cortisol? Cannot change work hours. Wake 2 a.m. Bedtime 7 p.m. Eat fatty meat 9 a.m. and 3 p.m. Would 1 egg with butter before 3 a.m. coffee help? Thank you.
So let's just talk about high cortisol. So first off, let's remember that cortisol is something that we all need. We would die if we didn't have it. But what are the things that cause high cortisol? Well, basically, the number one cause is we don't have a good, healthy circadian rhythm. And that means we don't have a good sleep cycle. That means we don't get up about the same time. We don't go to bed about the same time. We don't prepare for good sleep. So sleep hygiene is really, really important. I think carnivore is one of the best things for high cortisol because of the carnivore calm that we tend to get. And this is probably due to reduction in insulin resistance and improvement in some of your neuropeptides by eating carnivore, which has been shown in studies that you do that. Eating more fat helps to reduce your cortisol as well. So I think you're on the right track. Coffee, however, is a double-edged sword. And for me, coffee raises my cortisol. Okay. So I have to take a break from coffee every so often. And I know it's hard for a lot of people, but if I've done the sleep hygiene, I'm doing the daily activity, I do 7,000 steps a day, I'm in a community, I've got good relationships, my spiritual health is good, and I'm still having problems, I would try a 30-day trial with no coffee and no caffeine and no coffee, and just see how you feel and give it
hot water.
And that's what I do. When I give up water, I do hot water, and I heat it up in a little water heater to the temperature I would do coffee, which I think is 180 degrees. And I sit and drink it while I'm reading, and it's very relaxing.
And I would say if that still doesn't work, all those are very helpful maneuvers. You need to get out of doing shift work. It's sad because there are certain things that we need. If you're having a heart attack in the middle of the night, you would like to go to an emergency room that's open and staffed with people who are working there awake every night, right? So many things and services are necessary. Many other things that are open 24 hours a day, you don't really need. But if you're having a problem that involves you're breaking the circadian rhythm and all that, you need to try to get out of doing any type of shift work. Dr. Smith, Dr. Kiltz, and myself are from, by the way, I'm the younger of the three, but from an era where we did our residencies and internship, we could have been working straight for 3 days in a row. I did it multiple times.
Right.
I couldn't do it now. I couldn't be more than 24 hours awake consecutively, but it wrecks your health when you're working at night.
Yeah, the longest I went was 4 days with no sleep and working, at the hospital, taking care of patients for 4 days, not sitting around doing nothing for 4 days.
Yeah.
But it was pretty crazy. But we learned a lot, and but we had a mental bias that was not healthy, because we had to learn to compartmentalize and turn our lives off while we were practicing medicine. Because if you're doing a shift in the emergency room and someone comes in with a fatal car accident, and you try to resuscitate them, and you don't, and they die, you have to compartmentalize that experience and move on to the next patient. You can't mourn, you can't take a break, you can't take a moment to process what just happened. You just have to move to the next person. It's kind of like Lucy. I love Lucy and the chocolate coming down the conveyor belt. It's just a continuous thing, and it's not mentally healthy when we do what we did. But we have to work on that.
Okay, next question.
Well,
The
someone had a
strong.
question about the degenerative disc.
Oh, okay. Yeah, I do have that one. Let me
So,
find it.
yeah, I didn't do that yet. Yeah.
Just go down
So,
the
Oh,
list.
sorry. Okay, that was the next one. Somebody pulled that up. Okay, got it.
yeah. I mean, at a certain age, most of us have degenerative disc in our back, and it's just kind of a part of the aging process. And again, I wouldn't focus on the diagnosis or the finding. And I see people all the time that, oh, I got an MRI scan and it shows I have a bulging disc, and it's we get focused too much on these signs and symptoms, and when we really need to say, okay, what can I do about it? And the most common thing you do is eating fatty meats and reduce inflammation in your body, reducing the excess water that comes with inflammation in your body, which causes everything to swell up and narrows passageways and things like that, swells our cells, so to speak, and get our hormonal milieu, the way our hormones are regulated in our body, much healthier, and just to get active. And if you have pain when you're walking, the best thing when you have degenerative disc is to walk on a treadmill uphill, because it unloads the pressure on your disc. And I've had many people that could not walk flat who had low back pain, degenerative disc, and I had them go to the gym and put a treadmill up to somewhere between 5 and 10% grade and just walk on the treadmill every day and increase their time and then slowly decrease the grade. If you start at 10, you go down to 9 after a month or two, and then you go down to 8. And eventually you get to where you can walk on a flat surface. And focus less on what you've got and focus more on what can you do despite what you've got. And I think that mindset change is so important. I like to we tend in U.S. healthcare to have too much focus on acute disease, and yet we're dealing mainly with chronic health problems. And chronic health problems don't respond to quick fixes. So you have to focus your brain on what am I going to do? What can I own? What can I do to function at the best I can do? And I think the carnivore way of eating is a great start for most people. And we probably need to be moving more than we do as a society.
And I found carnivore tremendously helped and eliminated my back pain.
Illuminating or eliminating?
Eliminated. Illuminated that I was actually had a healthy body.
Yeah. 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 I look at, I have people come in and when I was in practice and they would say, oh, I've got bone spurs and blah, blah, blah. Well, yes, that's kind of the hallmark on x-ray. And if you looked at my x-ray of my neck, I played football in high school. And when I was in my 20s, I had the neck of a 90-year-old, but it doesn't cause me problems. Now, I can aggravate it if I do something really nuts, but I know the things that aggravate it, so I don't do those. And I've lived my whole life with it, and I don't regret playing football in high school. It was fun. Okay. Asking for a friend. I always love these questions.
Not me.
Vapes, is there perhaps an insulin response with sweet fruit flavor vapes causing weight gain in individuals or keep the carb cravings alive?
Yeah. Well, first off, I have to condemn vaping. Putting oils into your lungs is never a good idea. Because remember, if you know anything about lipids, the reason we have lipoproteins is because fat does not belong in our organs. And we don't want to be putting oils into our bronchial tubes and into our alveoli.
Yeah.
because the body can't do anything with them, and they actually cause inflammation and plugs. So the issue here is not the fruity taste, it's the vaping. And so I'm not going to give the other thing an answer because the vaping is the curse here. But I will add that anytime your body, if you have insulin resistance and your body is exposed to sweet things, artificial sweeteners and things like that, there is a cephalic pancreatic response that our body has, that when we perceive sweetness, like Pavlov's dogs, we can actually secrete and degranulate some insulin things and add some insulin to our bloodstream as a result of our brain perceiving that we're taking in something sweet. So, but let's focus on the vape as the issue. The vaping is the issue, not the fruitiness.
Yeah, cigarettes were soaked in sugar, and vaping, they just add sweetener to the same thing to make us more addicted to it.
Absolutely.
Yeah.
Next question.
It's a
That's more of
comment.
a comment.
I was muted. How do we join the Kiltz Mighty Tribe? It's free.
How
You go
do
to
we
Kiltz Mighty
do
Tribe.
that?
You go to Kiltz Mighty Tribe and you give your email.
Yeah.
You forfeit your email address, and that's how you join. You can find it on DrKiltz.com, KiltzHealth.com, or Kiltz Mighty Tribe.
And by the way, I'm also a member of FSBG, and you know, it's a great community is the most important thing here, and you gotta, you know, find your community, and there's so many great communities, and I'm a member of several.
Awesome. Glory, I am. I heard a popular YouTube heart doctor state that beef has been proven to cause cancer. Otherwise, he does a lot of intermittent fasting. Thoughts on the beef causing cancer?
What do you
Dr.
think?
Nelson, you want to take this?
Sure. It's not true, but it is the World Health Organization has classified red meat, in particular processed meat, as a possible carcinogen. When you do a review of the studies, there is a lot of confounders, number one, and the context matters. So there is no proof, no evidence that someone on a very low carbohydrate, a ketogenic diet, or even carnivore diet has an increased risk for cancer. And I'm actually doing a little bit of research on that, and the evidence is not there. Now, within a context of a Western diet, a chronic excessive carbohydrate consumption, hyperinsulinemic, and insulin, by the way, is a growth hormone as well. It helps you store fat, and it helps you grow, and cancer sometimes feed on that. And within the context of the diet, when you remove everything that may be contributing to cancer, there is no evidence that red meat really causes cancer.
And I agree 100% with everything you said. The research studies tend to be epidemiological studies,
Mm-hmm.
and they are not. Yes, people who get cancer probably have eaten beef in their lifetime, and that's about the strength of the weight. But it doesn't make sense that eating a diet where we see so many people reduce inflammation and reverse insulin resistance, that there should be a causation to cancer, because we are actually seeing an improvement in mitochondrial health. And there's been several studies that show very low carb ketogenic diets actually increase the numbers and the healthiness of your mitochondria. And that's been proven by some very, very good research. So we have more evidence that meat and low carb ketogenic diets actually lower your risk of cancer than any evidence that suggests that there's a causation from beef and cancer. So you can study anything, and epidemiological studies. I say, Dr. Nelson, you have a new cancer diagnosis. Have you ever eaten beef in your life? Yes or no? Well, you have? Well, it must have caused it. Well, no, that's not what causation is. Okay. So the idea of a causal link is kind of baloney science. So
scientism.
Yeah, scientism. I love that word.
Is there any major hair health related side effects to this kind of diet?
Under eating. If you don't get enough nutrition, if you're under eating, many people lose hair. And if you're losing hair on a carnivore diet, it's because you're undernourished.
Not enough fat.
Yep.
Lean meat, poison.
So eat more.
Karen asks, do you have questions you ask to help someone realize their current diet is inflammatory?
I don't know. Either you guys have an immediate answer to this. This is stumping me for a minute.
I usually ask people what they eat. They usually say organic, healthy, and clean. And
without defining each one of those terms.
Right. But then I just simply ask, do you eat fruits, vegetables, seeds, nuts, pizza, pasta, bread, salad, turkey, fish, chicken? And usually it's a yes for all those things. And that's but it's the question is all over the place. The answer is,
yeah, I think this is why you never really convince someone against their will. All you can do is put them in an environment where they see something and they begin to be curious and they wonder what's going on with Mr. A or Miss B, that they have something that's changing them that seems to be going in a positive direction, and I'm not going in a positive direction. And I have found that I can't convince people to do anything. All I can do is make a good case, be a good example, and wait for their limbic system to wake up and start observing with their own eyes and get into that curiosity mindset and wonder if maybe what is going on here. And that's why our stories are so important, because as Dr. Kiltz likes to say, it's the collective stories that are convincing to people. And it's not what you tell the person across the table. It's what you bring them to. So share videos, share stories, and let that do the work. Don't feel like you have to be the messenger for everything.
Let's see.
Let's go right down the list.
Yep. So Dr. Kiltz, Mike said he wants to actually answer from each doctor. Doctors, what's your opinion on tirzepatide for a carnivore to speed things up?
Who wants to go first?
Weights, walking, Wagyu, 1 meal a day. And visualize what you want as if it is, and it'll be there. Do we ever use it? Yeah, but mostly in the non-carnivore world. But some carnivores do it, but I wouldn't be like my top choices.
So I'm going to answer it as a physiologist. I believe in getting your hormonal axis healthy to rebalance your hormones. And if you take hormone replacements, they're really outside of Synthroid, which is levothyroxine, which is actually the same T4 as your body produces, and is Dr. Kiltz and I and Dr. Nelson, we took organic chemistry and we learned about L isomers. And the only medication I can think of other than are the biologic hormones, the biologic estrogen, the biologic synthroid, and all these GLP-1 drugs are analogs, what we call hormone analogs. And so they don't perfectly match your receptors. They are effective, but they actually suppress your body's production of those hormones. And so every hormone in your body works through what we call a negative feedback loop. And if you take something externally, it will prevent your body from trying to ramp up creating it for themselves. So I don't believe that these things speed up your carnivore journey. I think they actually inhibit your carnivore journey. Now, will they cause you to lose weight? Absolutely. But at a price. And I believe the healthiest person is the one who has their optimal hormonal health and not pharmaceutical health. That's just my bias.
And mindset, I think, is really important here. And like surgical procedures and most diets that they don't really fix all those things that Dr. Phil just mentioned, most people rebound are going to gain the weight back anyway.
Well, and the important thing is losing muscle mass, skeletal muscle mass. And these have a tendency to rob your skeletal muscles of proteins, which is probably, if you're our age, you would not want to lose any skeletal muscle mass inadvertently. Go ahead, Dr. Nelson. I'm sorry.
No, I was just going to mention some people. I mean, I don't know in what context they are asking the question. If someone has diabetes, for example, may be appropriate to do this while you're working on reversing diabetes and be a temporary stopgap. Someone comes to me requesting a GLP-1 just for weight loss, we're going to have a long discussion about that, because that's what they're being used mostly for nowadays. Probably the wrong thing to focus. Dr. Kiltz just gave you a good plan as far as a carnivore plan to lose weight. By the way, not everybody. There are people who are weight loss resistant with the GLP-1s. They don't lose weight. I spent over a year and a half, a few years ago, on a GLP-1. Didn't shed a pound until I changed my diet. And then I lost over 100 pounds. And I was on a high dose of a GLP-1, not tirzepatide. So I still think you can use these medications, that one and others, if you need them to help you along your journey in reversing your chronic problem. But ultimately, the purpose should be to get off of them and not use them indiscriminately.
Yeah, and Dr. Boz has been talking recently about microdose, but she makes sure that they are strongly ketotic before she adds on the microdose of these drugs. And that makes so much sense to me if you're going to use it as a bridge. But I think go carnivore for 90 days. And I do agree that if you have refractory disease, but the problem you got to understand is if you're a type 2 diabetic, one of the complications of diabetes is gastroparesis, which is paralysis of your stomach. And one of the complications of GLP-1s are gastroparesis. And I worry about people with diabetes. And even though we have clear clinical guidelines, we can use them. I would not, if I was still in practice, I would not be prescribing them, simply because I have seen the hell that people have gone through when they get gastroparesis, and they just can't eat, and they can't even take in calories because their stomach doesn't want to empty, and they're just nauseous all the time. And it's just, and some of these are really, really tough cases to resolve when it happens. It doesn't, it's, again, just a small percentage, but everything that you put in your body has risk. But I am worried about people taking any peptides that are hormone antagonist or agonist, because of the effect of shutting down your natural hormone productions.
Huge side effects. Huge.
Well, we quit using hormone replacement for perimenopausal symptoms years ago because giving pregnant mare estrogen to women increased their risk of breast cancer. I don't believe that biological, bioidentical estrogen causes breast cancer. But if you know anything about steroids hormones, they have a very, very specific scientific chemical anatomy, so to speak, that fits the human receptors perfectly. And when you take analogs, which are similar but not identical hormones, you don't know what that non-fit is going to lead to, because some cells will be affected by that hormone, fake hormone, and some will be affected in a different way that you don't intend. And I think we did a great disservice for women for 30 years with using hormone analogs. And I think we're going to find in 10 or 20 years that the GLPs ones probably have not been a good experiment. Just like we realized today that statins were not a good experiment for most people.
All right. Next question. Nico the Angelfish. Does not eating enough meat have any relation to the increase in autism in the past few years?
Don't know. I really don't know. I would suspect that we know that the brain needs cholesterol, it needs fat for healthy development. We know, and we've known for years, you don't give babies skim milk, you give them whole milk, because they need the fats. And I do get concerned, and there have been some major studies looking at high fat, very low carbohydrate ketogenic diets that show that brain development is better and depression and anxiety reverse. And I think in the carnivore community, we've seen anecdotal improvement in people with all kinds of neurologic disorders that we thought were permanent that are reversing with carnivore.
Yeah.
So Dr. Boz on her broadcast last week told the story about a 40-year-old who was a trisomy 21 who had developed dementia, and her dementia, and she became mute. And after months on being carnivore, she started talking again and making the longest sentences she had ever made in her life, using 3 words or more together, which she had not done in 40 years. And if you can take a 40-year-old and reverse dementia and improve their language, and someone that has a genetic disorder like that, I'd be very encouraged that it would help autism. We certainly know that inflammatory diets do not help our brain.
Low-fat diet is the worst thing we've ever recommended. And when we say fat, we talk animal fat, because plant and seed oils are not natural food products. They're strictly industrial, all of them, even olive oil and coconut oil and avocado oil.
And you think about cholesterol, is, 70% of our cell membranes, a big component of our myelin, which is a core component of our neurologic central nervous system. And you don't get cholesterol from plant sources. You only get it from animal sources. So what? Yeah.
A plant protein, low fat diet is our killer. It's really good.
Yeah, I have a book on my shelf in the back, Why Vegans Have Smaller Brains.
Yeah, that's a good book. Really good book.
Kathleen Jones, how do I make an appointment with Dr. Nelson in Tampa?
Well, Dr. Phil's in Tampa. I don't know if they meant Dr. Phil, but
coaching.
We do have, I think, in our description, the link to book a consult. And someone had asked if Dr. Phil is still seeing patients.
I think that's the same person. It's the same person.
Are you doing coaching online, Dr. Phil?
No, I don't do any coaching. I am doing the insulin resistance course, which is group interaction, but it's actually a pre-recorded course for 17 weeks. And then we have a live session one day a week with that to reinforce. But I don't do individual coaching, and I don't see patients anymore.
Which course is that, with Dr. Bickman?
No, this is something we do within SBG now.
Oh, okay.
But anyone can join it.
And these courses and these communities, I think, are the most important thing to really dig deep and learn and become an expert, a citizen expert. We're really the science is in the hands of all of us, not the doctors, the PhDs anymore.
So we're at an hour, but we've got like 17 more questions. Should we do?
We're not going to get to them. No, I gotta go because I get to the office today.
Okay, everyone, come to our 5:30 call and get your questions answered. 5:30 Eastern, Kiltz Mighty Tribe, and get the rest of these questions answered. Here, we got to do the giveaway.
So 5:30 today, we'll be there.
Yeah, 5:30 today. Bring these same questions, and you will get them answered.
I think you should say 5:30 p.m. since the hours you keep.
Yeah.
Oh yeah, it's 5:30 p.m. Eastern time.
Yeah.
We have been known to do 5 a.m.
I know you have.
Eastern time. And it's 5 a.m. somewhere.
It is 5 a.m. somewhere. So.
Kathleen Jones, congratulations. Please email me, alia@drkiltz.com, with your address and shirt size, and we will get your shirt sent to you. Thanks for playing.
Dr. Phil, thank you for being here.
Thanks for having me.
Yeah.
And I know you're usually in the steak and butter gal community, so you're welcome to go and visit us as well.
Okay, sounds good. I always enjoy when Dr. Kiltz comes and visits us, which he does monthly.
He'll be there on the 14th. There you go.
All right,
everybody.
very good.
Thank you so much. See you
Bye.
tomorrow tonight.
God bless.
Bye.